The federal government is creating an emergency medical system at no cost to users at point of care to improve primary health care, as well as support states with functional general hospitals, as some measures meant to increase equity of access to health care for the citizenry. The Minister of Health, Dr. Osage Hanere, gave the assurance at a press briefing in Benin City, the Edo State capital, on the occasion of the World Health Day, noting that the lessons from the coronavirus pandemic requires strengthening of the health sector. He also explains that the issues which led to the resident doctors' strike are being addressed and the strike will be called off soon. In the meantime, the World Health Organization country representative, Dr. Walter Kasadi, who was also at the event, spoke on the importance of accurate data collection in ensuring access to healthcare for the different groups in society.
A key challenge in overcoming inequities is that there is limited data showing who is being missed and why. To address this, national health information systems need to capture age, sex, and equity stratified data. This information can then be used to inform decision and policy making.
The federal government's next level agenda provides for mandatory health insurance for Nigerians to guarantee a basic minimum package of health services at no additional out-of-pocket cost to citizens. This basic minimum package of health services has been expanded to include service at general hospitals, not only at primary health care centers. To this end, the federal government will support states to reactivate their general hospitals. And while we're looking for one primary health care center at every political ward, we're looking for one functional general hospital in every local government. The health funding mechanism in the next level agenda complements the President's ongoing rehabilitation of the primary healthcare centers, and the model for such primary healthcare centers is available. We have standardized the model of what a primary healthcare center should look like. In addition to that, there is the emergency medical service and ambulance system that is under construction. The entire policy and framework is under construction to support access, physical access to hospitals and care centers, especially at odd hours of the night.
Well, we go over to Cross River State to find out what shape vaccinations are taking there. And joining us via Zoom is the Commissioner for Health, Dr. Betta Edu. Glad you could join us on the program.
Good evening. Thank you for having me.
All right. Tell us, since the vaccination started, have there been any adverse effects?
So we have not had any serious adverse effects following immunization in Cross River State since the vaccination exercise started in our state. We have vaccinated well over 25,000 Cross Riverans, and this is a little above half of what had been supplied to the state. And we have actually put the vaccination process for this first phase. We brought it to an end. We've put it on hold so that we can use the balance of the vaccines that we have to give the second dose to everyone who has taken the first dose at least 6 weeks down the line.
So you're saying no serious cases. How about mild cases? What are some of the mild cases that recipients you're getting from recipients?
So basically, we've had people call in with mild fever, which was managed with just paracetamol. We've had people call in with headache. And then, of course, some people have had some form of discomfort around the sites where the vaccination was given. But generally, we've not had any serious case where we've had to use the adverse effect following immunization kits, and we've not had a serious case where the contact numbers on the cards were called because there was a situation at hand. So really, we've not really had serious cases in Cross River State following the vaccination, and we've really done a lot But of course, for today, which is the World Health Day, beyond the vaccination, we in Cross River State are looking at system building, including the insurance, which would ensure that people can have access to quality healthcare services, people can have equity, and of course, there's unhindered quality health services rendered to people all across the state. And this is the way for Nigeria to go right now.
As much as vaccination is ongoing and the world is fighting the pandemic, looking at the other measures, the NPIs and also testing, is that still ongoing as well?
Oh, definitely. A lot of testing is ongoing, community sampling. We're happy that USAID came into the picture and they are supporting to move samples from the local government and the different sample sites to the state headquarters where the various, the 3 functional labs are testing for COVID. And of course, once the samples are sent in, the test results are sent out. We've had to stretch the vaccination even beyond the health workers. After we had covered the health workers, we had to look at certain strategic leaders who can take the message down to the grassroots. So testing is going on, vaccination is going on, isolation and treatment for people who need it is actually ongoing in Cross River State.
I must ask, because the Nigeria Association of Resident Doctors, the strike is ongoing and it is nationwide. Isn't that affecting healthcare in Cross River State?
It definitely is affecting healthcare in Cross River State, and it's affecting healthcare in Nigeria. A lot of work has to be done around human resources and making a comfortable environment for Nigerian doctors to thrive. We need to reduce the brain drain out of Nigeria, and we need to encourage them, give them the right incentives to push on. They're asking for the basics, and we hope the government, the federal government, can provide that almost immediately. The state health facilities do not run residency programs, and so they're going on, and there's no interruption to service at that level. But for the tertiary institution, which is the University of Calabar Teaching Hospital, the resident doctors have been on strike, and it's definitely affecting the treatment center and the isolation center, which is located there. So really, we hope that as the Honorable Minister have said, they can resolve whatever issues they are with the residents and they can go back to work as soon as possible. We need to be able to build a fairer and healthier world. And by doing that, we shouldn't be having so many strikes in a health sector that is fragile.
Indeed, Dr. Betta Edu, always a pleasure. Thank you so much for joining us on the program, Commissioner for Health, Cross River State.
You're welcome.